Dr. Subramanian Swaminathan, let me come to you first because you've been tracking these numbers very closely. When you look at the numbers, it appears there is an exponential rise. Some are now predicting that within a month from now, we could have or even 16 to 20 lakh cases at a peak period of Omicron variant or of COVID variant certainly. But hospitalizations at the moment are very low. But if it scales up, then hospitalizations could rise. So should we be pressing the panic button or be reassured by the low level of hospitalization that exists at the moment? In Mumbai today, not a single ICU bed was required.
Okay, so remember, we are moving on an exponential curve, and therefore it may not seem very close by, but when you're moving on an exponential rate, you're going to hit the peak even before you know of it. And I think you're being very generous when you say a month. I would say that the peak is going to happen much before the end of the month. And therefore, I think we should all be getting ready for huge numbers.
What is that peak? Sorry to what according to you, given that Omicron is about 4 times more infectious than Delta, what is the peak that you expect? Delta was 4 lakh cases per day.
So let's look at what's happening in the US. They projected 5 million cases or half a million cases per day based on the UK numbers. We are about 4 times US size. So let's say about 2 million cases a day at a peak. That would be kind of a ballpark figure of the new infections, but it's all dependent on how aggressively we test. Remember, in the US, they've rolled out self-test cards for rapid antigen tests so that the diagnosis can be made much, much faster. So I think this time around, unless we start pivoting it and start using rapid antigen tests so that we can do field-level testing and field-level diagnosis and quick turnaround and all of this, we may underestimate the numbers. Nevertheless, I think the numbers are going to be significantly high. And the concern is going to be a proportion of numbers. Even if the absolute proportion is very small, in terms of a huge spike, I think the relative numbers will still be visible. Don't compare everything with the Delta because the Delta was a catastrophe. Nobody wants to see another catastrophe. But if you look at what South Africa has projected, the death with Omicron so far at least is 16% mortality as compared to peak of Delta. So it's about 1 in 6, still a huge number. I don't think we should drop our guard against this. The good news is, yes, a lot of the people who are falling sick are younger people and they are bouncing back fairly quickly. But that is not to say that it's without any kind of risk and it is completely something we can ignore. I think it is going to be a problem because it could break the back of the health infrastructure because of 2 reasons. One is the incredible numbers of people who will need some form of care, may not need inpatient care, but at least some form of care, including children. And finally, also remember that outbreaks in healthcare have become a major issue. I just read of 87 doctors have become infected. And this kind of outbreaks are happening everywhere. Healthcare callouts is going up. And therefore, we are going to have a crunch in terms of healthcare workers being available.
Right.
And that's going to be a problem as well. So just because we have the beds and the oxygen and the ventilators, that doesn't mean everything is hunky-dory, because if we don't have the workers, I think we'll still have a problem.